A recent study finds many patients with a rare condition called hypoparathyroidism experience an average of 16 symptoms every day. The hormone disorder prevents the body from regulating calcium properly, often causing a range of symptoms from severe muscle spasms to brain fog, memory loss, and joint pain. Joining us to talk about the recent study and the condition are patient C.C. Donahue and physician Michael Levine. Good morning. Thank you for joining me today.
Good morning.
Good
Thanks
morning.
for having us.
Good morning.
So, Dr. Levine, please tell us, what does the recent study show?
Well, this recent study is very important because it helps us better understand the diversity of symptoms that patients with hypoparathyroidism can experience. And hypoparathyroidism is an uncommon disorder. There are about 60,000 patients in the United States. And this disorder is characterized by an inability of the body to regulate levels of blood calcium. And in most patients, it's the result of damage or removal of the parathyroid glands during thyroid surgery. And until recently, we understood that the low calcium level could cause symptoms of tingling in the fingertips or the toes or around the mouth and face, and maybe some muscle cramps, but we really didn't have a good idea of the diversity of symptoms that patients experienced every day. And what this study did was point out that patients not only had the symptoms I've talked about, but also some bone problems, joint problems, GI problems, and then brain fog, which Cece will talk about in a moment. And I think that this is important because for years, patients have come to us, many of them talking about some of these symptoms, and we didn't quite understand the relationship between these symptoms and hypoparathyroidism. So now we have a new context, and we're all very excited about that.
Oh, wow, that's interesting. Now, who is at risk?
So most patients who have hypoparathyroidism will have a history of prior thyroid surgery or surgery on the voice box because of cancer. So the number one risk group is going to be patients who've had head or neck surgery. And about 1% of patients who undergo these procedures will develop hypoparathyroidism. But there are other patients who have genetic causes of hypoparathyroidism, and sometimes these patients develop symptoms of low calcium in the first few years of life, and in other patients, the symptoms of hypocalcemia may not become problematic until patients are much older. But again, it's the surgery patients that are the greatest risk.
Oh, wow. Now, Cece, you are someone who is living with this condition every day. Please tell us, how many out of more than 16 symptoms do you experience, and what is that like for you?
Well, I can experience, a few of them or all of them. And over the past 10 years living with it, I have experienced most of them. I'm symptomatic every single day. I wake up with the benign kind of numbness and tingling in my hands and my feet and my face. And I stay that way until I can get the first dose of calcium in. Hopefully I can ward off a low dip in my calcium, because if not, I will experience the more severe symptoms of the bone pain, tremendous muscle pain, tetany, where my hands clench and I can't open them. My jaw will freeze. I can get laryngospasms, which create a huge problem in that my throat kind of swells shut and I can't even take my pills. So that occurs for me often, and it can come on very unexpectedly, and it's devastating. We call that a calcium crash when all of those symptoms occur. And I deal with it by medicating. I have to take anywhere from 14 to 25 pills a day in order to ward off the dreaded calcium crash. So it's very difficult, and it's a great burden.
Oh, wow. Now, besides medicating, and you said you take, there's a lot that you're going through. How do you cope with your condition emotionally?
Well, emotionally, I'm very fortunate. I have a very strong family network. I don't know if I've mentioned, but I have 5 children, 2 of which don't even remember me healthy. So they're all pretty used to dealing with me during the periods where I have a crash and I'm incapacitated, especially when I have the brain fog, because when I have brain fog, I can't my cognitive skills are so compromised that I really can't think my way through the day. So they're very adept and tuned in to my needs. My husband is amazing. In fact, when I first got sick, I was very sick for 2 years. He actually left his job and to come home to take care of the kids and take care of me. So I have a great emotional support. I also have a great faith in God, and that helps me a lot. But I also aligned myself 7 years into it. It took 7 years. For a while, I was the only person I knew with hypopara. We're that rare. But I found the Hypoparathyroidism Association, and through that, becoming involved in that association, and through them, they've actually linked me to other patients. They have conferences, we meet. I now have friends who are hypopara sufferers, and that is like gold.
Oh, wow, what an amazing experience. Dr. Levine, can you suggest, how do you suggest patients who cope with the condition, what do you suggest that they do, or what advice do you have for them?
Well, it's very important that they identify a physician, an endocrinologist, a doctor who treats patients with gland and hormone disorders. Identify an endocrinologist with experience treating hypoparathyroidism. They can also avail themselves of a great source of information, hypoparathyroidism.com. It's a great website that is very useful to patients, their families, and even their physicians. And I think the other thing to remember is that taking conventional treatment with activated forms of vitamin D and calcium can place patients at risk of developing kidney stones. And so when patients are being monitored by taking blood tests, they have to remind their physicians to also look at the amount of calcium in the urine to make sure that they're not putting themselves in a position of risk of kidney stones.
Oh, wow. And thank you so much for sharing that. And it sounds as if hypoparathyroidism is something that can truly impact the life, but with the proper treatment and the right support system, people can go on to live a healthy and productive life. And for more information, please visit www.hypoparathyroidism.com. Thank you so much for speaking with me again today, Dr. Levine and Cece.
Thank
you very much.